Patello-Femoral Pain Syndrome is the topic of today's Dr. Ozello's Sports Medicine Report. The nickname of this condition is runner's knee. It is one of the most common non-traumatic knee injuries. It's an overuse injury. All overuse injuries have three basic characteristics that are the source of those conditions, and runner's knee is no exception. Overtraining, inadequate rest between training sessions, and a biomechanical fault. Those three combined together are the source of all overtraining injuries. The biomechanical fault in runner's knee is a strength imbalance in the quadriceps muscles. The quadriceps are the powerful muscles in the front of the thigh. The vastus lateralis is the long muscle on the outside of the thigh. That is stronger and it overpowers the medial aspect of the thigh, which is called the vastus medialis. The symptoms of Patello-Femoral Pain Syndrome are located vaguely around the kneecap. There can be pain directly behind the kneecap. There can be pain on the inside of the kneecap. It can be one specific spot, or it can be along the entire inside of the kneecap, or it can be on the outside of the kneecap. In my office, I always ask people to point to exactly where the pain is at. Some could point to one exact spot, and others will say it's sort of around the outside or it's around the inside. So it's vaguely positioned around the kneecap. These symptoms include deep, dull, achy pain, sort of that nagging type of pain. It has an insidious onset, begins real slow, doesn't come on immediately, begins progressively, gets worse. One very important thing about this condition is it can get worse and it can cause damage to the cartilage behind the kneecap. That is another condition called chondromalacia patella. If Patello-Femoral syndrome is not, Patello-Femoral pain syndrome is not taken care of, it can lead to further damage to the cartilage behind it. The symptoms of runner's knee can be aggravated by some very specific activities. These include walking or running downhill, walking or running down steps, sitting for a long time with the knee in a bent position. Many times after we've been sitting for a long time, we need to stand up and make that kneecap sort of pop or crack, or we have that feeling that we need to do that. Once we do that, the symptoms lessen for a short time. But that is what usually happens with this condition, is you feel that tightness and it just sort of needs to crack or pop. That is something that's very common with Patello-Femoral Pain Syndrome. Now, I had mentioned before the biomechanical fault of the strength imbalance. That is what we call the intrinsic factor. All overuse injuries have the extrinsic factor and the intrinsic factor. The intrinsic factor is what I stated before. It's a strength imbalance between the muscles in the lateral or the outside of the quadricep compared to the muscles on the inside, or what we call in medical terms the medial aspect of the quadriceps. The extrinsic factors that contribute to Patello-Femoral Pain Syndrome are overtraining. Simply stated, doing too much too soon and not allowing your body to recover between your training sessions. Now I'm going to talk about the anatomy of the quadriceps and the knee for just a minute so you understand exactly how everything works and why the strength imbalance creates this issue. The quadriceps are a group of four muscles in the front of the thigh. They work to extend the knee, and one of them also crosses the hip joint, so it does part of hip flexion. The main thing it does is extend the knee. Those muscles have tendons that connect to the kneecap, and the kneecap tendon, this tendon up here above the kneecap or superior to the kneecap, we call that the quadriceps tendons. And then the patella, nicknamed the kneecap, is engulfed in the tendon, and the rest of the tendon comes down here and attaches to the front part of the lower leg. The part below the patella is called the patellar tendon. But what happens is that the muscle in the medial aspect connects over here, the muscle in the lateral aspect connects over here. Biomechanically, the lateral aspect, the vastus lateralis, has a very distinct advantage. The medialis comes down and kind of curves in obliquely. This part of the muscle right here is what we always commonly hear about. It's the VMO, the vastus medialis oblique. This part of the muscle gets overpowered by right here. So the vastus lateralis has that distinct advantage. It's much stronger. So when we are extending the knee and flexing the knee, what happens is the patella is supposed to move along its groove just like this. But when there's a strength imbalance, the patella slides outwards. This is what we call patella tracking problems. Patella tracking is how the patella moves. And then it slides like this. This is an exaggeration, but that's how it moves. And so that creates issues with the problem. I mean, that creates issues with the way that the kneecap sits in that groove. This condition is also a little bit more common in females than it is in men, because that groove is not as deep in females as it is in men. But what we want to think about is restoring that proper motion. So you want to strengthen this muscle out here, you want to foam roll, and you want to stretch the muscle that's on the outside while strengthening the muscle that's in through here. Other factors that may contribute to the formation of runner's knee are wider hips, narrower knees, hyperpronation of the foot. They can all contribute to it, but the main biomechanical fault, like I said, is a strength imbalance in the quadriceps. And we think about when we combine that strength imbalance with the repetition of training, especially in runners, over and over and over again when we are running, that patella keeps sliding like this. And that is what causes the symptoms. Now, we want to prevent this. That is one of the most important things. And I've said it before, and I'll say it again, and it sounds so simple, but it's something that we need to do. Prevention is easier, faster, and less expensive than injury rehabilitation. So do everything you can to prevent this injury, and if you had it in the past, do everything you can to prevent a recurrence. You're going to do yourself a big favor. How do we do that? First of all, eliminate the extrinsic factors, the training problems that lead to overtraining. You want to train hard, but you want to train smart. You want to work at a level that you are currently at and gradually increase in intensity. Gradually increase your distance, your hill work, your speed work. General rule is 10% a week. Now that doesn't seem like very much, but you think about it, in 6 weeks or in 8 weeks, that's a lot. And if that's going to help to prevent an injury that can be performance limiting, then that's what you want to do. You want to train smart. Increase your intensity in very gradual increments. It is going to help a great deal to prevent any type of repetitive trauma that leads to an overuse injury. Also, cross-training. Cross-training is vital in prevention of injuries, but it's also imperative in getting the maximum benefit from your training by increasing your overall health and fitness. So you want to make sure you stretch. You want to make sure you do strength training. You want to ensure that you strengthen your heart and strengthen your lungs. Do upper body conditioning. Do lower body conditioning. Strengthen your core. It's going to help a great deal. Another factor that I didn't mention with the other ones that I should have is weakness in the gluteal muscles, especially in the gluteus medius muscle. That can lead to unlevel pelvis when we're moving, and that can cause symptoms in the spine and in the lower extremities. So you want to make sure that your gluteal muscles are strong, especially your gluteus medius. Your gluteal muscles are part of the core. So doing great core training that is very thorough will help you a great deal in preventing runner's knee. Eliminating the chief intrinsic contributing factor, should be the number one thing in your prevention of runner's knee. Also in the rehabilitation of runner's knee. Several exercises will help to not only strengthen the vastus medialis, but will help to strengthen the entire medial thigh. If you can perform squats, what you want to do is do the type of squats called sumo squats, where you take a wider stance, you have the knees and the feet angled outward. Always keep the knees pointing in the same direction as the feet, and you want to squat down through a pain-free range of motion, then come back up. That is going to target the medial aspect of the thigh. Also, you can do any type of exercise that is what we call hip adduction or adduction, where the leg moves towards the center of the body or towards the opposite side. You can do that in a standing position with cables or a resistance band, but specifically to target the medial aspect of the thigh and the vastus medialis is you can do that in a seated position. And you can do it with exercise device, something very similar to one of the thigh masters. You could do it with a resistance band. You can even do it with your hands, where you're just doing this right here. That will help to strengthen this muscle and will also help to strengthen the muscles in the inside part of the thigh that are next to it that help to do the adduction. You can also perform some exercises where you are completely focusing on the vastus medialis, and that will help to eliminate the intrinsic source of runner's knee. If you start to feel symptoms in and around the kneecap, do not hesitate. Begin your self-treatment immediately and begin your professional treatment immediately. Get it checked by a medical professional. In my office, I see a lot of runners, a lot of athletes who have Patello-Femoral Pain Syndrome. The earlier the treatment begins, the better. We want to make sure that everything is functioning properly. And first of all, you want to eliminate any other sources of these symptoms. You want to make sure that an even more serious pathology is not present. That's why professional help is one of the things that you want to do. But what I do in my office as a doctor of chiropractic will help with Patello-Femoral Pain Syndrome because it's going to restore proper skeletal motion, everything from the foot, the ankle, the knee, the pelvis, the hips, the lumbar spine, all the way up the spine. This one chain, everything works together. So we want to make sure there's proper motion in all those areas. Also, we're going to restore and optimize proper nerve flow coming from the brain, going all the way down the spine, branching off the spine, going to these muscles. That's what chiropractic care is going to specifically help with. Also, patient education. I'm going to teach my patients things that they can do to help themselves to recover from this condition. And I spoke about that a little bit before, strengthening the medial aspect of the thigh, strengthening the vastus medialis, especially the vastus medialis oblique, and then eliminate any other intrinsic factors. I had spoken about weakness of the gluteus medius. We want to eliminate that. Also, if there's hyperpronation, you could strengthen the foot muscles. That will help a great deal. That's where chiropractic patient education comes into play. One other thing that I do recommend for anyone who has Patello-Femoral Pain Syndrome is foam rolling the vastus lateralis and stretching the vastus lateralis. That will help a great deal to combat that strength imbalance. So, key factors here. If you start to feel pain, do not hesitate. Start your self-treatment and seek professional treatment. It's going to help you a great deal. It's going to help to eliminate the intrinsic sources of this condition. Then modify your training. Modify your training so you want to train smart. It's going to help you a great deal in eliminating the intrinsic and the extrinsic sources of Patello-Femoral Pain Syndrome. If you did suffer from runner's knee and you've been doing your self-treatment, you've been getting your professional treatment, your return to activity should be very gradual. You want to start at your current health and do not start your training at what you were before. Do not start your training at what your friend is at. Start at your current fitness level and build up from there. It's going to help you a great deal. Patello-Femoral Syndrome is a serious condition. It is a chapter in my book on page 71, chapter 11. Patello-Femoral Pain Syndrome is a very common injury among runners. Eliminate the extrinsic sources and the intrinsic sources to prevent this condition and to recover from this condition. Thank you everyone for viewing my video. Train hard, train smart, stay injury-free, and accomplish your goals. This is Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada.